Welcome to Medicare Minutes. Each picture in the collage will describe how Medicare has impacted the lives of beneficiaries like you.
My mother ended up in the hospital last spring after she fell in the shower. We thought her care at the hospital was excellent, and she seemed to be making good progress. When the staff told us that they were going to discharge her, we believed that she wasn't ready to go home. We felt confused. We wouldn't have known what to do if the hospital hadn't given us the important message from Medicare. It had all of Mom's discharge information and what to do if we disagreed with the hospital's recommendation for discharge. We called the number on the paper, which turned out to be our state's Medicare Quality Improvement Organization, or QIO. The QIO explained that Mom had the right to request an appeal to her discharge and helped us stop the discharge while the QIO's nurses and doctors did a review to see if Mom needed to stay in the hospital or if she was ready for the next level of care. It was such a relief to know that Mom's discharge was being looked at by other healthcare professionals who were ready to help us out.
When my niece discovered a lump on her breast, I wanted to do everything I could to be supportive. I went with her to her mammogram, and after a few days of worrying, the x-ray results came back. No cancer. That scare helped me realize the importance of getting a mammogram, and it got me thinking that I'm 60 years old and have never had a mammogram myself. So I decided to schedule a mammogram, and this time my niece went with me. Of course, I was pleased when I got the good news, but I didn't let it stop there. I talked to all my silver sneaker friends and suggested that we all do our part by getting a mammogram so that our doctors would be able to detect any abnormalities and to reduce our chances of getting breast cancer. Each one of us got a mammogram, and we all walked in the race for the cure last October.
To be perfectly honest, I wasn't really too shocked when my doctor told me last year that I have high blood pressure. I'd been feeling pretty bad. I was overweight. I knew that my diet was full of fast food and salt. Plus, I have a family history of hypertension, so I'm already at a higher risk. But I was glad that my doctor looked me straight in the eye and explained to me what could happen if I didn't get my symptoms under control. I could have a stroke or a heart attack. I have grandchildren, and boy, do I want to see them grow up. So I changed my lifestyle. I started riding my bicycle for 20 minutes every day. I'm eating a healthier diet with more fruits and vegetables and less salt. I also set a daily alert on my cell phone that reminds me to take my blood pressure medicine. Making small changes has made a big difference in keeping my blood pressure under control. I thought change would be hard, but I'm really enjoying this new life.
I'm no dummy, but sometimes when I leave the doctor's office, I feel a little lost and too embarrassed to admit it. There are so many medical words I don't understand and so much to remember. So, when I had to have surgery last winter, I knew that I was going to have to make some changes so that I could take care of my health care. I needed to really understand what was going to happen to me and what I needed to do to get better fast. I decided to start writing my questions down before my appointment. When I was with my doctor, I would ask lots of questions. Sometimes I even brought my medication bottles right into the doctor's office so that she could see everything I was taking from all my doctors. To top that off, when I didn't feel well one day, I asked a friend to go with me to my appointment to help me take notes. My doctor liked my ideas and told me so. Before I knew it, I was talking comfortably with my doctor and seeing that she really wanted to hear my concerns and thought they were important. Now I feel like I am part of the team, my healthcare team.
Recently, my mother was discharged from the hospital, but after several days at home, she wasn't feeling well and returned to the emergency room. She was readmitted to the hospital for several more days. It turned out that when she was discharged the first time, she was given 2 prescriptions to fill and an order to contact her family doctor for a follow-up visit within 48 hours. My mother couldn't remember being given those instructions. I called the local Medicare Quality Improvement Organization, QIO, to help my mother during her hospital discharge. The QIO informed me that I could find a document called Your Discharge Planning Checklist on the Medicare.gov website. I was able to visit the website and download the checklist to take with me to the hospital when my mom was discharged the second time. Now, Mom is recovering nicely at home.
Last winter, I slipped on the ice and broke my hip. I was in the hospital for 2 weeks and was sent to a nursing facility for rehabilitation. Now that I am home again, I have so many doctor appointments that I am having trouble keeping track of them all. Last week, I missed an appointment and forgot to refill one of my prescriptions. This morning, when I called to reschedule my appointment, the receptionist suggested that I ask my doctor about a personal health record. She said that there was a booklet that could help me record my medical appointments, the medications I am taking, and past medical events, like my fall last winter. She said that having a personal health record would help ensure that my medical information was in one place. It's even the perfect size to carry in my handbag. Now I will bring my personal health record booklet to all of my medical appointments, including my pharmacy visits. One simple tool is helping me take charge of my own health care.
I went to a walk-in clinic because I was feeling tired and sluggish and kept having a headache that didn't seem to go away. The doctor asked me about my symptoms and what my medications were that I was taking. I showed him my high blood pressure medicine, my arthritis medicine, vitamins, and some non-prescription medicine for my insomnia. That's when he told me about a program called Medication Therapy Management, or MTM, where my local pharmacist could help me keep track of my medications, including the time of day, the number of days per week that I take my medications. He told me that my pharmacist would be able to determine if any of my medicines weren't supposed to be taken with other medicines, or could be causing me to have side effects, like having headaches or feeling tired. He also said that my pharmacist would work closely with all of my doctors, especially if changes had to be made with my medications. I didn't know about MTM, but since I talked with my pharmacist and my doctors, I'm confident that I'm taking my medications the way that I'm supposed to, and that they really are helping me.
After I had my surgery, I went to a nursing home for physical therapy to get my strength back. I wanted to go home as soon as possible, was concerned because I live alone. I called 1-800-MEDICARE for help and was referred to my state's quality improvement organization. That was the best phone call I've ever made. The woman on the phone listened to my concerns. She was very knowledgeable and talked with me about my home care needs and offered to contact the nursing home social worker on my behalf. She and the social worker talked about everything I had told her, and the next thing I knew, the social worker had called a meeting with my doctor, my physical therapist, the head nurse, and me. We all worked together on my discharge plan so that once I was ready to go home, I would have a visiting nurse and a physical therapist coming to my home to help me out and make sure I was okay. Boy, was I relieved and thankful that I made that call.